The project is looking at the use of MRI, either replacing the current tests that we do or to be an additional test when we're looking at and assessing nasal speech in some of our patients.
The ways that we've examined palate function, palate movement in the past have been either taking lateral x-rays, moving x-rays of the palate, and or passing telescopes through the nose to look at the palate and the back of the throat and how well they're functioning and whether they're closing.
So there are two tests that we do at the moment, but we know that MRI is really one of the best ways of actually looking at muscles. And as muscles and the palate are really important in making sure that the palate lifts and closes when it needs to when we're making our sounds in speech. The group thought that it would be a good way and important work for us to see, is there something else that we need to do in order to get the best assessment for children when we're deciding either their surgical or their therapy management.
The current problems with MRI scanning are firstly the quality of the image. So the more frames per second, the less good the quality. But of course this is a very rapidly moving structure, so you do need rapid movement. That's one thing, and this is one aspect that our research team at Barts, they're working on. Secondly, the noise of the machine, which tends to mask the spoken voice.
Vanessa.
And thirdly, it's a slightly frightening environment for a small child. I think a lot of progress has already been made, but there are some of these problems have still to be overcome. So further funding from CLEFT will allow this project to continue and to make it more clinically applicable and useful. And we are very keen that CLEFT raises more money to support this project as it goes on.
So we hope that it will be an easier option and a better quality of assessment, and also gives us both the lateral view, the video fluoroscopy view, and the endoscopy from one assessment.